Hi, welcome to this second episode of Fertility Guru. Today we are going to understand how to select a fertility center. Now, whenever the thought to take fertility treatment comes to the mind of the couple, a lot of the people want to go through the website. I think that's the logical first step, and then you go through all the reviews. But review is just a tip of the iceberg. It's not always they're very true, it's not there, they're very wrong. The negative reviews not necessarily means a bad center, right? So they're very complex things and they differ from the couples which give review. And yes, it is the tip of the iceberg. Now the main important things are, is there any difference in two IVF centers? Now since the ART bill has come into enactment, most of the IVF centers or fertility center approved will have to maintain few minimum gold standards of practice, and it's already set. So it's very clear that most of the centers are at par with each other, and from infrastructure point of view it's difficult to choose one over the other. So the main important question which comes is, what makes one IVF center better than the other? There are two things. One is who is the IVF consultant. Two, how are the success rate? And these two factors should determine how the fertility center is. And the problem with these two factors is you require to have a word to word publicity, and that's what helps. Online reviews or videos or other things, they can guide you, but I think mouth to mouth publicity is something which really gives the insight, because one experienced couple is sharing their experience with the others. The success rate, however, are something which no one knows. No one publishes it, and it's difficult to publish. So, if I have to tell you that a success rate for you, a particular couple, is 40%, it cannot be a generalized statement. Success rate depends on the age of the female, the genetic history in the clinical scenario, how the quality of eggs and embryos are produced, and how is the lining of the uterus and other factors. So, if I have to just say that two good quality embryos for a 30-year-old woman would produce a success rate of around 60%, I am speaking about blastocyst or day 5 embryos. The same two embryos would produce around 40% success rate at the age of 35 to 36. At the age of 38, it would drop down to around 30%. At the age of 40, it would produce 25% success rate. And at 42 and above, it would just produce success rate of 5 to 10%. Because as the age advances, genetic quality of embryos keep declining, or they become more and more abnormal. And so, the IVF consultant with his experience and the success rate become the two predominant factor, and you can come to know only by mouth to mouth publicity. The next factor which can tell us is the cost. Now, cost varies from center to center on their mental approach, whether they are corporate or non-corporate centers, and what are the overheads the center is bearing, and that there can be vast differences in the cost, ranging in the range of 20 to 30%, and it differs from centers to centers. Some centers do offer packages like 2 or 3 IVF cycle in around 2 to 3 lakhs of rupees, and so there can be varying packages. Package system are just one of the carrots to bring a patient to the fertility center. Some might approve, some may not approve, but if it is going to benefit the couple, it's worth it. Now, the miscellaneous factors which decide are the travel distance, how far is the center from your place. Okay, that's the most important relevant point in this present conditions where traveling from home to the center on a daily basis becomes difficult. But believe me, it is important to choose the center depending on the IVF consultant and its success rates. The travel time is the least of concerns because fertility treatment can be modified in such a way that the number of visits to the clinics can be limited, and that's going to take the overall burden of the couple about traveling in uh, heavy traffic and the stress associated with it. So I think in a nutshell, IVF center can be best described by who is the IVF consultant and its success rates. Experience for most people does matter, and I think everybody knows that with time everyone becomes experienced enough to take good care of the patients. I think I would like to stop my talk now. In the next topic onwards, what I am going to say is we are going to tackle this issue of various myths in IVF treatment, and we're going to tackle it one point at a time. Thank you.